Welcome back to the King's Podcast, The Wellness Style with Lackie. I'm your host, Esther Lackie. Today we are joined by Dr. Suruchi Vohra, specialist dermatologist with a special focus on pediatric dermatology. And she'll be taking us on a deep dive into eczema and atopic dermatitis. Dr. Suruchi, I hope that's okay if I call you Dr. Suruchi or Dr. Vohra. Which one is better?
Dr. Suruchi is fine.
Dr. Suruchi, okay.
Yes. Thank you so much.
Thank you for joining us today, and forgive us for taking you away from your busy clinic.
It's all right. Thank you. My
Yeah.
pleasure.
So today we are focusing on atopic dermatitis, eczema. What's the difference between these two?
Okay. Yeah, it's a very good question, I would say. So eczema is an umbrella term. We use it for any type of red, itchy, inflamed skin condition. So there are 7 different type of eczema,
Mhm,
and the most common type is atopic dermatitis, which we see mostly in children.
mhm,
And it's the most persistent form of eczema as well.
mhm.
Many times people use it in, the eczema as well as atopic dermatitis, these two terms interchangeably, because atopic dermatitis is the most common type of eczema we see in the clinical practice.
So today we are discussing atopic dermatitis or eczema. Or
Okay, so we will be discussing about atopic dermatitis, but there is a kind of overlap. So if I'm discussing about some tips and pearls, which can implicate on eczema as well.
How common is atopic dermatitis?
So it's a very, very common skin condition. So if we look at our dermatology clinics, this is one of the commonest skin condition we see in our clinics.
Mhm.
Being, patients being referred to us for that. There are millions of people living with eczema worldwide. And if we look at numbers in UK, so 1 in 5 children have atopic dermatitis.
Mhm.
So when we look at the UAE number, so around 1 in 5 children as well have atopic dermatitis,
Mhm.
and 1 in 10 adult has atopic dermatitis.
Mhm.
It's a very common skin condition, but many people don't know about it and don't know things about it, and there are many myths as well.
Mhm.
So I think it's a good idea to talk about this topic.
Okay, all right. So I'm just going to dial back. Atopic dermatitis is such a mouthful, so I'm just going to refer to it as eczema.
Yeah.
So what are the general causes of eczema?
So there is no single cause for eczema.
Mm.
Yeah, it's a very complex disease. There are 2 important factors which play a role in the development of eczema. So one is a person's gene, and second is the environment.
Mhm.
So to explain, I would like to first of all make you go through what exactly a skin is and what is the role of the skin. As we see that the skin is the outermost layer, right, in our body, and this is the
And I hear it's the biggest organ.
yes, it's the biggest organ, and this is the organ which is exposed outside in the environment.
Mhm.
So if we look at the top layer of the skin, which is stratum corneum, okay, so it is made up of certain proteins as well as certain lipids. So it's a very tough barrier which help us protect our body from the environment. So it has keratin, which is most important protein, and the same protein is present in our hair and in the nails.
Mhm.
And this keratin is locked with each other nicely with the help of certain proteins called filaggrin and then certain lipids like ceramides.
Mhm.
So it's a very complex structure that helps to protect us from the environment. Now, what happened is those people who have atopic dermatitis, their skin is lacking in certain proteins and certain ceramides. So years of research has shown that they are deficient in a protein called filaggrin. Okay, so you can imagine now the skin, which was supposed to be like a tough barrier, has leaky channels because it doesn't have the right constituents. So what happened is the water from inside, which is meant to keep our skins healthy and supple, goes out and evaporates in that environment, leaving the skin dry. And at the same time, it also exposes our body to outside allergens. So we can call bacteria, viruses, or any allergen in the environment can enter into the skin because of these leaky channels and can trigger our immune system. So this is the genes. Yeah.
Okay.
And the second factor is the environment. So if we talk about environment, extreme heat, which is very common in Dubai, and leading to sweating. In the same way, extreme cold, very high humidity, very low humidity, dust. So house dust might also plays a part, and smoking or any skincare products we are using, if we are using harsh soaps, we are using hand sanitizers, that further degrades the skin barrier and makes it even more leaky, causing more inflammation. So the end result is inflammation, leading to red, itchy rashes. So there's no single cause for eczema. Yeah.
So you're basically born with it.
Yes.
In most cases.
So in 70 to 80% of the people, we would get family history, either in parents or in siblings. And we can get either family history of atopic dermatitis or other conditions, atopic conditions like hay fever or eczema. So all these conditions are linked, and it's determined by similar kind of genes. Yeah. So, but there are some people who may not have it, we may not get the family history in 10 to 20% of the cases, but you still can have eczema or develop eczema.
So, for instance, I have a sister. She had a very severe case of eczema flare-ups. It would just flare up, and it used to be so bad. But then her kids, yes, they have eczema, but it's not as bad. It's less severe. It's just, like here and there. How do you explain this?
The research has been done, but we don't yet have the answer. So eczema can be of various severity. It can range from mild to moderate to severe. Everyone has a different journey, and that's why we have to optimize the treatment as well based on the patient's condition. So there is no answer to it. Why is it the children
more severe in some cases and less severe in others?
Exactly. So there is no answer to that, but could be related to the genes and the way their skin barrier is working, and also the environment and the triggers they are getting exposed to. Yeah.
All right. And on the body, are there certain areas that are more prone to have these rashes, these eczema rashes?
Yeah, certainly. So eczema can affect anywhere in the body from head to toe. But based on what age group it is affecting, we do see some predisposition in certain area, certain part of the body. So if we look at a newborn baby, or maybe a child and an infant who is presenting with eczema to us for the first time, generally we would see their eczema would start at the age of 6 months, and it starts at the cheeks. So their cheeks would be red, itchy, and sometimes it can get so much inflamed that it can become wet and oozy as well. So the cheek is the most affected area in the babies, and that certainly is because they are always drooling. So the saliva goes and smears on the cheeks and causes irritation.
The saliva is like a trigger.
It can be, and even food. So when they are started on solids, and the time when they started to be weaned off, they are being exposed to many kind of food, and when they are eating, the food is getting exposed to the cheeks, and that's when they start developing eczema. And when the next stage comes, when they start to crawl, the eczema starts affecting on their outer aspect of the elbows and the outer aspect of the knees. That's because when they are crawling, they are getting exposed to the environmental allergens on the floor. So that's where we see the eczema. So, but if a child is presenting after 2 years of age, we generally see the eczema is affecting on their skin folds. So like the neck fold, or the elbow fold, or the knee fold. So creases, the areas where the skin, rub each other, or the heat or sweat can be accumulated for too long. And then if we go higher up, if we look at adults, generally most of the kids would start developing eczema by their 6th birthday, but there is no exception. Sometimes it can start even after 18 years of age, and it can affect any part of the body. So like in adults, we see hand dermatitis, eczema only affecting the hands, or eczema affecting only the eyelids. Yeah, so it has varied presentation. Every person is very different.
Okay, all right. I know you just mentioned that it's genetic and it can be caused by environmental factors.
Yes.
I have to ask, is it contagious?
No. So it's a myth that it is contagious, but it doesn't spread by touching. So sometimes the rash of eczema can become wet. It can become very oozy, and people might think it can spread to another person by touching it, but it doesn't. And so it is really important to put this message across to people that it is not a contagious condition.
And are there any certain skin types that are more prone to developing eczema than others?
No. So it's all related to gene. It's seen in all kind of races. Okay, so it can be seen at any age group. So there is no skin type, but yes, we do see that those people who have eczema tend to have more dry skin. Their skin is quite dry and rough to touch. And that's because of their leaky skin barrier.
Okay, I know when it comes to diagnosing eczema, a mother says her baby is developing a rash. Of course, the first thing to do is take her directly to the pediatrician.
Yes.
What about like a teenager or an adult when they start developing eczema? When should they come and see you? And other than writing it off and saying, oh, it's just something that's going to blow over.
Many times the rashes can be non-specific and short-lasting, which can be managed with just moisturizers and over-the-counter medications. But if the rash is persistent, I would say more than 3 months, you should consult a dermatologist, because many times people would think that it's just a skin disease and they would self-treat it by many different kind of skincare products, because over the shelf there are many moisturizers available, even there are OTC creams available, but those creams can further irritate the skin, and by the time they come and consult a dermatologist, it can get even further worsened. So it's good idea, if you're seeing the rash is not getting better with a certain amount of creams being used, you should consult a dermatologist.
And if one develops a rash that they suspect it's eczema, would you advise them to do an allergy test?
Usually, no. That's a very good question. So, allergy test is not really indicated as the first line in management, because eczema and allergy are two different things. And many parents actually, when they come for the consult, the first thing they would ask, can you please do some test and run some allergy tests and find out what particular food my child is allergic to, and which is driving all this process. And that's where it's I think that's the common myth, that eczema is allergy, but it's not. So there are certain pointers when we do allergy testing, so to food or maybe environment. So the if the history is sounding like a child being fed certain food, let's say we can say peanut or eggs, which are more allergenic, and within eating, within minutes or hours of eating that food, the child is developing the rash, that's the history where we look at and we think about doing allergy testing. Yeah. Or a child who is presenting to us with very severe form of eczema, we are trying treating it and it's not getting better. So we think whether it could be some other trigger like food, then we would consider doing a food allergy test. So it's not the first thing we do in our clinic.
What kind of foods are actually the culprits in triggering eczema?
Okay, so generally there are few group of foods which are more allergenic, and we try to focus on those in the history. So it's generally in a newborn baby or in an infant who is coming with eczema, and if it's really extensive, we always ask to exclude milk allergy. Apart from this, eggs, peanut, and soy, and wheat, these are the common culprits. But later, people can develop allergy to seafood as well, and fish. So these are the common allergens we come across as in our clinical practice.
So when you're testing for food allergy, you test for all this?
So we do, there are two type of allergy testing. One is the food allergy and the environmental allergy. In food, we usually test for the food I just mentioned. And for environmental things, we generally look at house dust mite, pollens, we look at pets, allergy to the pet hair, or cockroaches. So these are two different type of panels.
And from years of experience and seeing patients with eczema, how does it affect their quality of life? Actually, if it does in the first place.
Yeah, so eczema is, as I said, it can vary from mild to moderate to severe disease. If it is mild, it's kind of manageable. We will, if they are on the right treatment, and the parents and the person who is affected by eczema, if they know what to do, it can be managed. But a lot of time it is kind of brushed off that it's just a skin disease, but it's not. So I have seen in my clinical practice people who are living with eczema for many years. It can be even 20 years with chronic extensive eczema affecting all over their body, and it does affect their quality of life, because the constant factor which is there in eczema is the itch. So they have to live with the itch which is constantly there, and they are not able to sleep at night. That affects the quality of life, because the next day they are not able to focus on their work. So if we look at kids who are living with atopic dermatitis, severe form of atopic dermatitis, they are not able to focus in their studies. And they are also at the same time bullied as well because they have a rash on their skin, which the other kids in the school can't understand. So they can get bullied as well. And it has even shown, the studies have shown that the kids can have certain mental health issues as well because of this, because of lack of speak and sleep, and that impacts their study and that impact their school performance.
How do you treat it?
So there are two important pillars of management, I would say. So one is, first of all, it's really important to spend time with the patient, or the parent of the child who is presenting with atopic dermatitis, to make them understand that what is driving all this, so that we can find out what could be the trigger in his or her particular case. So counseling and going through general advice, which involves lifestyle modification. So we look at the history, if there is any pets in the house. So we do discuss that if there are pets, they might have to, and they are found allergic, they must be remove the pet from the house. Then it involves taking care with all the house dust mites. So there should not be carpets in the house, there should not be thick curtains in the house, and the linens should be washed regularly. And also, apart from this, it involves a continuous regular skincare routine. So we need to go through that, the way how they bathe. So important tips are like, a lot of time people tend to shower with very hot water. So that's important that they don't take hot shower. They take shower very quick, 5 to 10 minutes with lukewarm water, with a non-soapy cleanser, with a gentle cleanser, which doesn't lather so much and doesn't dry the skin further. Yeah. And followed by that, immediate application of a moisturizer. So I generally recommend my patients to use a moisturizer within 2 to 3 minutes of stepping out of the shower area, because when your skin is moist, that's when, if you apply the moisturizer, the skin will, it will lock in the moisture inside. So these are general skincare routines they need to follow. And it's really important because the moisturizer is something, nowadays we have moisturizer which have been specially designed based on the research that which they have all the ingredients like ceramides and filaggrin, which are lacking in the skin barrier. So that helps to rebuild the skin barrier. And so they need to reapply. So many times a day, consistently throughout the body. Okay. So this is what we call like a general management. And the second pillar of management, where the dermatologist would come, where we can prescribe treatment based on the severity. So most commonly we would treat with creams like topical corticosteroids. We have now non-steroidal creams as well. So we would treat with that. Sometimes we give antihistamines. And if it gets infected, we do add sometimes oral antibiotics as well. And if it is really severe, there are other treatment options like light treatment or oral tablets. And even now we have biologic injections available, which are much more safer.
All right.
Yeah.
Thanks, Doc. So you mentioned that eczema can occur at any age.
Yes.
So when it comes to the treatment, how does treatment for children with eczema differ from that of adults?
Yeah, so it's a good question. So children are not just small. They are not just like small or small adults, I would say. So there are different things we need to keep into perspective when we are treating children with atopic dermatitis. So all the treatments are not considered safe in children. So we have to look at the all the factors and the age group. So if an infant is coming or a toddler is coming with the atopic dermatitis, we tend to use safer treatment options like creams. That would be our first line treatment to go through. We won't go jump onto other treatments like oral medications like immunosuppressants or biologics. So that's how we differ. And a lot of time in children, there are other psychosocial factors as well coming into the play. So we need to discuss that as well. And it's and also they are going to the school, so that we have to discuss all this with the parents and make a treatment. So usually what I do is I discuss with the parents, and I usually take a collaborative approach. So I listen to the parents, I lay facts in front of them, and then decide and make a plan based on what is comfortable for them and what is best clinical practice to do.
All right. So there are quite a number of people who have this phobia or concern for topical steroids. How do you work around that when it comes to treating eczema?
Yeah, so yes, it's steroid phobia is a really, really big concern actually. And it can be challenging for the doctors while treating it, because now there are many social media pages which are discussing about topical steroid usage. And I agree there are some side effects, and we usually advocate appropriate usage of steroid in different strength in different body areas. So if you're using a steroid cream under the supervision with a dermatologist, and you've been told how much to be used, and which particular strength to be used, it's generally safe, and it's the safest medical treatment to do. Okay, there are side effects which can happen with steroids usage, but that's if you're using it inappropriately. So there are 7 classes of steroid creams available, and we decide which one should be used based on the age, based on the severity, based on which part of the body we are using. And we try to taper off the steroid creams as early as possible once we get the control and move them to non-steroidal creams. So that's how we manage it. So it's really important to talk to the parents and do a little bit of hand holding and make them understand that it's not really gonna cause side effects, and come for a regular follow-up so that we can see whether is it causing any side effects or not.
So, Doc, I have this little friend. She says she has eczema, and it gets triggered by certain clothes that she wears.
Yeah.
Can clothes really trigger eczema flare-up?
Yeah, it can. So, not in Dubai context, but yes, if you're living in a cold country and if you're wearing woolly clothes and the woolly clothes is coming in directly contact with the skin, it will worsen and irritate the skin, and it can cause trigger inflammation. So it's always advisable to wear cotton clothes, loose clothing and comfortable clothing. Even the elastic band in the clothes can irritate your skin
and cause a flare-up.
And can cause a flare-up. So we just need to understand that the skin is really sensitive.
All right.
And it can triggered by anything in the environment.
Wow, wow. Doc, thank you so much for joining us today. But before you go, what's our takeaway? What would you like people to know about eczema or atopic dermatitis?
Okay, so I would say that, don't consider it just like a simple, it's just a skin rash. People are living with much more severe disease, and it can be a big nuisance for them. It doesn't cause mortality, but it does cause a lot of morbidity on a person's life. So it should be taken seriously, and it should be managed properly, and a person should take early consult with the dermatologist.
Amazing. Thank you so much again for joining us today. And we look forward to seeing you again next time.
Thank you. It was my pleasure.
Yeah.
Thank you.
Ladies and gentlemen, Dr. Suruchi Vohra, specialist dermatologist. If you'd like to see her or book a consultation with her, you can find her down at our Dubai Marina Clinic. Until next time, bye.